Welcome to Oncology Tube. The American Society of Clinical Oncology, or ASCO, has released new guidelines on sentinel lymph node biopsy, or SLNB, for early-stage breast cancer. This could impact thousands of patients. Published in the Journal of Clinical Oncology in 2025, this guideline update, led by experts like Dr. Ko-Eun Park and Dr. Mark Sommerfield, is turning heads. It's based on a review of 11 randomized clinical trials, 8 meta-analyses, and a prospective cohort study spanning 2016 to 2024. What does this mean for patients with early-stage breast cancer? The guideline focuses on stages 1 and 2, offering 6 key recommendations. First, some patients may not need SLNB at all. For postmenopausal women aged 50 or older with small, low-risk breast cancers, tumors 2 centimeters or less, hormone receptor positive and HER2 negative, doctors can skip SLNB if there's no sign of lymph node issues on an ultrasound. For those 65 and older, radiation might not be necessary. Studies like SOUND and INSEMA show no difference in survival when SLNB is skipped in these cases, with axillary recurrence rates as low as 1 to 1.7%. Next, the guideline says skipping SLNB shouldn't change radiation or systemic therapy plans, including genomic tests like the 21-gene recurrence score. Trials like INSEMA required whole breast radiation, while SOUND allowed partial breast radiation, and outcomes remained strong. For patients with 1 or 2 positive sentinel nodes who are getting breast-conserving surgery and radiation, the guideline says no to full axillary lymph node dissection, or ALND. The ASCO Z011 and SENOMAC trials found ALND doesn't improve survival, but increases lymphedema risks, up to 24.5% compared to 11.9% with radiation alone. For those undergoing mastectomy with 1 or 2 positive nodes, ALND can be skipped, provided they receive post-mastectomy radiation with regional nodal irradiation. But if radiation isn't planned, or if 3 or more nodes are positive, ALND is recommended. The AMOROS and SENOMAC trials back this, showing radiation matches ALND's outcomes with less harm. If no lymph node metastases are found, ALND is off the table. The NSABP B32 trial confirms it doesn't improve survival and just raises lymphedema risks. The guideline also covers special cases. SLNB may be offered for multicentric tumors, male breast cancer, pregnancy, obesity, larger tumors, or DCIS with mastectomy. But it's not routine for DCIS with breast-conserving surgery or for checking internal mammary nodes. For inflammatory breast cancer or confirmed node issues, ALND is the go-to treatment. These recommendations rely on limited data, so doctors and patients need to discuss options carefully. A critical issue here is health equity. The guideline highlights disparities, especially for Black patients who faced higher rates of ALND and lymphedema, 12% versus 8% for white patients. ASCO calls for better access to care and communication to address these gaps. There's also good news on costs. Studies show skipping SLNB can save money and improve quality of life by reducing complications like lymphedema. ASCO urges doctors to discuss financial options with patients to ease the burden. This guideline, endorsed by the American Society for Radiation Oncology, is reshaping breast cancer care. Subscribe here and go to oncologytube.com for more on this and many other topics.